Most patients make at least one of these 6 mistakes before getting their lips augmented. Watch this video before you get your lips done and find out how to avoid disappointment. What are the most common mistakes, and how can you get the procedure done right without ruining your face? My name is Monika Wijwa. I am an aesthetic medicine doctor from Krakow, and this is the first mistake. You want too much at once. Hardly anyone talks about this on Instagram when showing before and after results. That the most important factor for the final result is the initial effect. That's a surprise, isn't it? Hardly anyone scrolling through Instagram looks at the before lip photo as long as they look at the after lips. Next time, if you take a close look at how the lips looked before the procedure, there's a good chance they were already full and had a very nice shape. Unfortunately, not everyone has lips like that, and that's when it's easy to make the mistake of wanting too much at once. Alright, but what exactly does too much at once mean? You often hear that more than 1 milliliter at a time is too much. But be careful. The truth is, even 1 milliliter at once can often be too much for a first procedure. If the lips are small, they simply might not be able to handle such a large amount of filler at once, like 1 milliliter or more. And this very easily leads to hyaluronic acid migration and an ugly, unnatural effect. My recommendation? Don't focus on how many milliliters you'll be getting, and definitely don't decide that on your own. It's the doctor's job to perform the procedure properly according to your expectations. By the way, patients often ask me before the procedure how many milliliters I plan to inject. And I always answer, quite consciously, that I don't know. My goal is not to use up the entire syringe of product, but to achieve a beautiful and natural effect within the natural capacity of the lips. During the procedure, I check how the lips respond and where the optimum is, and only then do I know how much filler is used, but the numbers matter the least here. Speaking of what doesn't matter, the second mistake before lip augmentation is going for the procedure when you really shouldn't be doing it at all. Mistake number 2. You enlarge your lips to improve their color. Listen to me carefully now, because I come across this mistake exceptionally often. If you have a light lip color, a pale vermilion border, and you want to enlarge them to make them more visible, this procedure might not be for you at all. Let me refer once again to the before and after effects you see on Instagram. Such comparisons raise our expectations in a way that in the post-procedure photo, the lip pigment appears more pronounced. I'm sure you've seen this more than once. The problem is that enlarging the lips with filler does not improve the pigment. What you see on Instagram are lips that are not only enlarged, but most often also painted and with gloss applied. A few years ago, I tested this on myself. I took a photo of my lips in their natural state and then another identical one, but this time with my lips painted with gloss. I labeled them as before and after treatment results. And guess what happened? Everyone admired the beautiful and natural looking enhancement. So if you usually wear colorful lipstick and that's when you're 100% happy with how your lips look, lip augmentation might not be for you at all. So what should you do instead? In that case, consider permanent makeup, which will enhance your lip pigment just the way you want. There's one more mistake very similar to this one that almost every woman makes before getting lip augmentation. Mistake number 3. Do you want to even out your lip contour with hyaluronic acid? What's that about? Imagine this situation. You've had cold sores on your lips many times in your life. Unfortunately, such cold sores cause the lip contour to blur, which, along with aging, makes it less and less visible. Your lips start to look less attractive, with a blurred, uneven contour. And then, eureka, you think to yourself, I need to make them bigger. You might be surprised, but if you're in a similar situation, enlarging your lips with hyaluronic acid will only make the problem worse. Let me be clear. There's no way this procedure will restore the defined lip contour that cold sores have taken away from us. That's why, before you go for the procedure at the clinic, consider whether permanent makeup that gives you a lasting contour might not be a better option. At the same time, you'll improve your lip color and avoid the discomfort associated with enlargement procedures, because you should know that this procedure is painful. Speaking of taking care of your appearance wisely, I prepared a 5-day challenge for you to achieve better skin, which you can download for free as a PDF. Each day, you'll receive one specific task from me. Simple, but truly effective, which will improve the appearance of your skin at home without any aesthetic medicine procedures. You can find the link to the challenge in the description below this video. The challenge is completely free and many people have told me it was a real game changer for them. Join in, give it a try because you have nothing to lose. But do you know where you definitely risk a lot? When you make mistake number 4 before getting your lips enhanced. Mistake number 4. You don't want to dissolve your lips before the next enhancement. To help you visualize what I mean, imagine a park bench. A bench like that needs to be painted every few years to keep it looking nice. Now, to paint such a bench, you can thoroughly prepare it for painting, meaning you strip off the old paint, smooth the surface, apply a primer, and only then paint it. That way, the result will be perfect, and the bench will look like new. There's also a second option. You can simply grab a brush and paint the bench without any preparation or cleaning. I'm sure you've seen that kind of result. Many layers of peeling paint, an uneven surface, and generally speaking, a poorly done job. It's the same with lips. If they've been enlarged multiple times and the practitioner just keeps adding and adding more product, it's very easy to lose the shape and simply do a poor job. In another video, I mentioned that hyaluronic acid can remain in small deposits even many years after being injected into the skin. This means that even if your lips don't have as much volume as they used to when you were most satisfied, the filler might still be there. That's why if your doctor suggests dissolving the filler before another augmentation, they probably know what they're doing. Thanks to this, the final result will be better and you'll be more satisfied. However, if you think that before lip augmentation, it's as simple as just checking whether they're big or small, you definitely need to hear about the next mistake. Mistake number 5. You don't know about other options besides hyaluronic acid. Of course, this isn't the patient's mistake, but the practitioners who doesn't look at the face holistically as a whole. And the face isn't just a place where lips are attached that need to be enlarged over and over again. I'm serious. Before anyone sticks a needle into your lips, it's absolutely necessary to assess the function of the facial muscles around the mouth. I'm talking especially about the orbicularis oris muscle, which is responsible for making a pout and turning out the lips, and the depressor anguli oris muscle, which makes us pull a face like Obama. Alright, but why should we look at how the muscles work if what you want is bigger lips? These two facial muscles are very important for the shape of your lips when you speak and in everyday function. It could be that the balance between these muscles isn't quite right for you, and for example, your lips curl inward when you speak, making them appear smaller than they actually are. In that case, instead of enlarging your lips with hyaluronic acid, a better procedure would be the so-called lip flip, which I talk about in this video. It often happens in my practice that a patient comes in planning to get a lip augmentation, but ends up having a completely different procedure, achieving better and more natural results without hyaluronic acid. Speaking of natural results, there is one last mistake that I feel thousands of people make when deciding to have their lips augmented with hyaluronic acid. Mistake number 6. You repeat the procedures too often. In my opinion, this mistake leads to the fact that every day on the streets you see people who have overdone it with hyaluronic acid. But watch out. What if I told you that these people believe they haven't overdone it at all? Imagine a situation like this which you have surely experienced yourself. You went to the hairdresser just to trim the ends, and as hairdressers sometimes do, they cut your hair in half. You come home, you feel very strange about yourself, and maybe you even feel like crying because of it all. But after a few days, when you look at your new haircut, it already feels normal. So you get used to this look, and the shorter hair becomes your new normal, something you accept. And now pay attention. We can get used to anything in this way, even to hyaluronic acid. So bigger lips become the new norm. The problem is that hyaluronic acid is broken down by the body, which means that from the moment of the procedure, your lips gradually get smaller over the following months. And this can lead to a situation where you quickly feel the urge to enlarge them again. How can you avoid overdoing the procedures and not getting them done too often? There are 2 ways to do this. The first is a home method. Take photos and videos of yourself before the procedure. Then take photos a few days after the procedure, once your lips have healed, but the effect is at its maximum. This way, every time in the future when you think it's time for another procedure, you can compare your lips before, after, and now, and see what the reality is. The second way to avoid repeating the procedure too often: choose a doctor who won't be afraid to say stop and simply refuse to perform the procedure if your natural look would be compromised. In other words, look for someone who will put your well-being above their own financial gain. Dear ones, after watching this video, if you've made it this far, you might get the impression that it's never worth getting your lips enhanced. It's actually the opposite. Hyaluronic acid can be a fantastic procedure if we have the right indications for it. It's also worth knowing what the entire procedure looks like step by step. That's why I recorded a special video where I show how I perform this procedure on Justina, and I also interview her before and after the treatment, so you can see exactly what everything looks like step by step. The thumbnail for that video is now showing on the screen. Click and keep watching. I also have a huge favor to ask. If you leave me a comment under this video, there's a good chance that YouTube will show it to even more people. So if you learned something interesting from this video, please leave me a comment. Thank you for watching and see you in the next video. Kisses.